Low back pain is one of the number one reasons that people go to their doctor. People with back pain come into several categories. The most common cause of low back pain is what doctors term mechanical low back pain, which is muscles. So somehow the muscle has been strained and you may end up with muscle spasm. The pain is localized mostly to the back. You may have a little bit of radiation of the pain into the buttocks or into the leg, but it's still localized mostly to the back, typically worse with movement. One of the most important things for the patient to realize, I think, is the kind of the red flag warnings for back pain where something more serious might be occurring. And those red flag warnings are things like radiation of the pain beyond the thigh. So if you have radiation of pain down the leg, that suggests that there may be a bulging disc or something like that occurring. Also, if there's fever involved, then you worry about infection within the spine, which is a possibility. Increasing pain and severity, and numbness and tingling, those are also red flags that there may be something more serious going on with the back and that you need more evaluation other than just an exam. Most of the time when you present with back pain to a clinic, a doctor's going to take a history, figure out if you injured it, if you had trauma, some sort of trauma like a car accident or you fell or something like that, then the doc's probably going to do x-rays to look to make sure that you don't have anything going on with the bony structures such as a fracture or compression fracture, that sort of thing. If you don't have trauma and it was a twisting motion or a lifting motion, something like that, the doc may or may not do x-rays, but is going to palpate your back to see if you have muscle spasm, that kind of thing, put you through some range of motions of your back to see what your motion's like and see if he can elicit the exact pain that's occurring. And then treatment-wise, for most patients, since mechanical low back pain or muscle spasm is the most common cause, anti-inflammatory medicines in patients that they're appropriate for is going to be the mainstay of treatment, as well as heat to the back, some stretching exercises, and possibly muscle relaxers to help do that. But probably in the end, I would say that the most important part of that treatment is going to be stopping the offending activity. So, if you're lifting weights and you develop back pain after that, you need to lay off the weights. And so, typically patients are going to have their activity limited for maybe 3 to 6 weeks, decrease how much they're lifting at work, try to avoid as much bending and stooping and that sort of thing as possible until the muscle has time to basically heal itself.